Good evening, everyone, and thank you so much for joining us tonight for the Beauty Triangle webinar. It's amazing to have so many of you here this evening. I hope you're all well and staying sane at home. For those of you who don't know me, I'm Francesca White and I'm the founder of the Beauty Triangle. So for anyone who's new to our talks, the Beauty Triangle is a platform that aims to get people talking about their health and well-being, and always from a holistic standpoint. So our monthly discussions always address a single topic and always with a panel of 3 speakers who we refer to as our Beauty Triangle. What's important to us is putting reliable information from the most expert practitioners out there, but also to provide a safe space where our audiences can ask the questions that they need answers to. Which brings us to tonight's discussion, which is very much a celebration of women at every stage of life, but with a specific focus on pre and post pregnancy. As women, we are inherently in touch with our bodies. They enable us to bring another life into the world and to nurture it, but they can also contribute to low self-esteem and even a lack of control when they no longer look or feel like our own. So the idea of this webinar is to answer the questions that any woman might have, whether she's planning a pregnancy, in her final trimester, or had children many years ago. And luckily we have a fantastic panel with us to help, including Pilates PT and founder of the Bump Plan, Hollie Grant, aesthetic doctor and postnatal specialist, Dr. Selena Langdon, and breast and body surgeon, Mrs. Jacqueline Lewis. And altogether, we're going to be discussing everything that we need to know about strengthening, restoring, and even rebuilding our bodies at every stage of the journey. So do pop any questions that you have in the Q&A box at the bottom of your screen, and we'll do our very best to make it a part of the discussion. That's enough from me. I'm going to hand over to our speakers to say a quick hello and to introduce themselves, and then we'll get cracking with the conversation. So Hollie, maybe you'd like to kick things off.
Yep. Hi everybody, I'm Hollie Grant. I am a Pilates expert, personal trainer and advanced prenatal specialist, and also founder of Pilates PT and the Bump Plan.
Thank you so much, Hollie. Lovely to have you with us. Selena, over to you.
Hello, hi everyone. I'm Dr. Selena Langdon. I'm the founder and medical director of the clinic for Berkshire Aesthetics. We oversee a lot of aesthetic procedures, lots of just non-surgical treatments. And so, yeah, it'll be really interesting to talk to these guys today.
Amazing. Thanks, Selena. And Jackie.
Hi, I'm Dr. Jacqueline Lewis. I'm a mother, so I know what happens to the body, and I've tried all the treatments myself to go through them. I became a plastic surgeon and then a breast surgeon. So yeah, I can tell you all about changes to the body and how to fix them surgically or not, because I've gone and looked at them all. So I'm really interested to hear what everyone else has to say about them.
Thanks so much, Jackie. And yeah, I think we're all going to be riveted by all the information that's coming from the 3 of you. You're all incredible experts and specialists. So very exciting hour that we have ahead of us. So our first panelist will go back to Hollie, who, as I mentioned, is otherwise known as the Pilates PT. I've known Hollie for a number of years now, and I love her approach to exercise, which is nothing short of empowering, as I think we're about to find out. So firstly, Hollie, huge thanks for being here with us tonight. Maybe we can kick off just by talking about Pilates and specifically how it helps to strengthen the body in preparation for pregnancy.
Yeah, so Pilates, I feel like it's quite confusing. Even when I try and describe what Pilates is, it's really difficult to kind of pinpoint. But instead, I like to try and say what Pilates will do for your body. So obviously, it's a form of exercise. And those exercises aim to strengthen the body. That's definitely the main point of it, to build as strong a body as possible, to make the body really functional. So all of the muscles in the body work equally well so that the body can work to its best ability. Hopefully then you're less likely to be injured. And also by being strong all over and every single muscle being as strong as the others, we'll also have more freedom of movement. So we'll be flexible. So that's kind of what Pilates offers. It's low impact. So it's often advised for people who are pregnant or who are injured, or also who are maybe a little bit older. And I feel that almost brings with it a perception that it's easy and that it's boring. And actually,
oh my God, that's so not the case. I've done one of your classes.
Exactly. It's what you make it. And what I love about Pilates is it will quite literally help anybody. So yes, I've got clients who are in their 80s, but, you know, I've also got clients who are in their, you know, teen ballet, you know, ballerinas. So it can literally help anybody.
And I think that's what's so sort of relevant about the conversation that all of us will be having, which is that all of these things will be very relevant to women pre and postnatally, but actually they're just relevant for women at any stage of life. You know, we can all do with having a stronger, more resilient body. And I guess this is just a great sort of way to get on the right foot.
Yeah, and I think that, so, you know, my background is that I've been trying to, for the last 10 years, trying to encourage women to put how their bodies function first rather than how they look. You know, diet culture is very prevalent in the fitness industry, and a lot of the marketing tools that gyms will use is explaining, telling you, selling you this dream that exercise will make you look better and then everything else will be perfect. But actually, if we think more about how the body functions, that's really what exercise is for. And I think that it comes into its own when you're either trying to get pregnant or when you are pregnant, because that's when you do start thinking about how healthy your body is, how it functions. And if we think about what the changes that happen to a pregnant woman, Pilates is perfect for that. So Pilates is the thing to start doing before you get pregnant, so that during your pregnancy, you're more comfortable, you're stronger, you're able to deal with the postural changes that will inevitably happen. And also you're preparing your body for motherhood. And if we think of what life is like with a baby, buggies are heavy, car seats are heavy, babies are heavy. So we need to get strong for that.
You're about to get the work out of your life in 9 months' time, so start now.
And the way we word it is, pregnancy is the longest marathon you'll ever run, and motherhood and labor are probably the hardest marathons you'll run. So why wouldn't you prepare for them? Why wouldn't you train for them ahead of time?
It's so true. And I think all of those elements that you touched on, you know, the postural changes, and even, which you didn't talk about, is the breathing, which is obviously a huge part of Pilates as well. All of those elements are so relevant to all of us, I think, particularly whilst we're at home so much more. We've got sort of strange at-home working setups, or we're dealing with sort of increased stress and anxiety. So it really is a very holistic approach to exercise. Specifically thinking of pregnancy, does the body need different support in each trimester? Because obviously you've got very different stages going on and changes in those different periods of time.
Yeah, so traditionally what you would find with prenatal fitness, for example, is classes would just be for pre and postnatal. And that's always really bothered me. That's always really annoyed me, because actually what someone in week 8 of their pregnancy needs is very different to what someone in week 12 postnatal needs. But if we think of each trimester, in the first trimester, the guidelines can be a bit wishy-washy, but in general, you can do everything you did before in theory. So if you're having a straightforward pregnancy, you didn't get pregnant via IVF, or you've not got a history of miscarriage, then in your first trimester, you can carry on as normal. But for most women, that feels a bit odd. They don't always want to do HIIT. It feels strange knowing that there's a baby in you, but that you can just carry on with doing all the exercise you did before.
Yeah.
But you can, in theory. As soon as we get to the second trimester, we might be starting to notice a bump, which obviously makes things feel different. But also we start having considerations like you can't lie on your back for longer than around 3 minutes past about week 16, which is something maybe we've not thought about. And
so
if
the exercises then need to evolve to reflect that.
Think how many exercises you do lying on your back, especially in something like Pilates or yoga. So there's considerations there, but also, you know, we need to start thinking about the changes that need to occur in your abdominals. You've got a baby behind your abdominals and they need to go somewhere. So the abdominals do shift around, your internal organs shift around, but your abdominals
splitting, can't you, as well?
Yeah, so we have, you know, we've got lots of different abdominals, but we've got 6-pack abdominals or rectus abdominis that run down the middle of our tummies that don't connect directly to each other, but they've got some tissue in between the linea alba. And as your baby grows, they do separate. And we think it's 99% of pregnancies will have abdominal separation, diastasis recti.
Gosh, I didn't realize it was that high, 99%.
Yeah, because often women will say to me, how can I prevent diastasis? And what we say is it's a perfectly normal part of pregnancy. You know, those muscles do need to separate, otherwise where will your baby go? So there's lots of changes that happen in the core. So do we really want to still be doing exercises that are strengthening those six-pack abdominals? No, not really. But do we want to be strengthening our transverse abdominis, which is like our corset muscle that wraps around our trunk? Yes. So we start thinking about adapting what our main focus for the core is in second trimester.
And then you're almost reinforcing the scaffolding of the body so that it's best supported.
You're letting the muscles that need to relax, and then the muscles that need to be ready and stay active to support you as your baby gets heavier. You know, you're making sure that they're staying on and doing their job. And then by the third trimester, you know, often women think that the more pregnant you get, the less you can do. And actually that's really not the case. It's just different. So in the third trimester, we should really be starting to think about labor. So whether you're planning on a vaginal birth or a cesarean, or you end up with an emergency cesarean, you know, really all the things that we can do to prepare for those are quite similar. And in the third trimester, we can start thinking about what do we need to strengthen ahead of a heavy baby coming along.
Is that pelvic floor, for example?
I would, the pelvic floor it's like one of those magical areas of the body that we only think about all of a sudden when things aren't going right. And pregnancy and menopause tend to be those two times that we think, oh my gosh, I've got a pelvic floor.
So true.
I would say going into pregnancy, it's try to go into pregnancy if you can already strong. But then of course the demands on the pelvic floor as your uterus gets heavier, get greater. And so there is a tougher job for the pelvic floor. And so it's a case of trying to stay on top of that and trying to stay on top of your strength, ready for postnatally when things will need a bit of help.
Yeah, so it's very much about the sort of preemptive pelvic floor strengthening that we can do as well. All the things that, exactly as you say, you think you wouldn't have to start thinking about until you actually get pregnant, but there's a whole sort of game plan to all of this, isn't there? And I think it's really important what you said about that sort of fear of exercise that a lot of women have, particularly if, you know, maybe it's their first pregnancy, or, you know, maybe they've had sort of issues along the way, you know, and I think it is important that we recognize that, you know, continuing to exercise is good for our physical, but also our emotional health as well. It's a brilliant sort of outlet for women when there's a lot of stuff going on and a lot of hormonal change as well. But I mean, as well as Pilates, you're also a huge advocate for low impact cardio, aren't you? For pregnant women and for, you know, non-pregnant women. Why exactly is the low impact cardio so important in this formula?
So if we think of the goals of fitness during pregnancy, it's not really a time to be getting PBs or starting kind of new crazy fitness regimes. And let's be honest, most women probably aren't going to want to do that anyway. But what we say is the goals should be maintaining your fitness and maintaining your strength. And so if we break those two down, if we want to maintain our strength, personally, I think Pilates is perfect for that because it is all about strength. And if we want to maintain our fitness, then we're going to have to do some cardio. And in the background, I think for a long time now, the prenatal industry hasn't really been serviced enough. It's not good enough. It's not inspiring enough, and it doesn't excite women enough, which is something that we're really trying to change. But there's also seems to be this kind of underlying myth that exercise and miscarriage are linked in some way. And actually, when you look at the research, there is nothing to suggest, again, if you are just a healthy, low-risk pregnancy, that there is any link between exercise and miscarriage. So I think
that's a really important fact to put out there, because there must be so many women who are then preventing themselves from taking the exercise out of fear that, you know, that they're doing all of these things wrong. And it's obviously not the case.
The number of rumors that I hear, like the number of things that women have heard from friends, it's kind of, you know, just Chinese whispers. Somewhere along the line, the research has just been skewed. So actually the research is that moderate intensity cardio is completely fine.
So what's moderate intensity? Is that sort of light weights or a jog, or how do you define it?
Well, if we go back to thinking about the difference between sort of strength work and cardiovascular then, so if we're trying to maintain our fitness, we want to make sure that we're including something something that has a cardiovascular effect. So something that is getting the heart rate increased. So something that's getting the heart pumping, something that's requiring you to breathe faster and take in more oxygen. And so that can be anything. You know, what might make me a little bit out of breath will be very different from what gets my husband out of breath. So it's really individual. But what we say with moderate intensity cardio, at a moderate intensity, you would still be able to talk, but you would be out of breath. You know, you'd be talking, but you'd sound like you're some kind of, you know, dodgy phone caller. So you could still talk, or I prefer thinking of a scale of 1 to 10. So 1 is you sat on the sofa doing nothing, and 10 is you at the end of a marathon before you got pregnant. You kind of want to aim for an effort level of around 6 or 7. So it's really important to start kind of getting to know your body and how it feels and what are your limits. And so moderate intensity cardio is actually really, really beneficial during pregnancy. You can use your talk test, so as long as you can still talk, or you can use your scale of 1 to 10. And the reason why I prefer the low impact option, you know, your baby is cushioned, your baby is really happy in there. It's actually more, the reason I don't care for women jumping around when they're pregnant is your boobs tend to hurt and your pelvic floor already has a massive job. So do you really want to be bouncing around?
Exactly. And also, you know, if we're just talking about fundamentally, you know, staying in shape and maintaining good cardiovascular health, you don't need to exert all of that energy in order to do so. You know, you're just as well going for a brisk uphill walk as you are running around your local park and, you know, in the most tightly fitted sports bra you can find.
Yeah, you'll find as well that as soon as you get pregnant, there are lots of hormonal changes that go on in the background, and you actually during pregnancy, your body creates up to 50% more blood. So you end up with up to 50% more blood in your body. That blood needs oxygenating. So pregnant women tend to find that things like walking up the stairs that didn't bother them before actually start to feel really quite hard work. So as you know, you might find that moderate intensity exercise is actually really easy to do, and just doing like grapevine might get you to that 6 or 7 out of 10. So it doesn't even have to be anything crazy. You know, you don't need special equipment. Just getting your body moving will do that for you. And
exactly, and listening to it as well.
Yeah.
When we're talking about exercise, you know, this is very much about what you do in the lead up to pregnancy and during pregnancy, but following the birth, how long until you should look to resume Pilates or indeed any form of exercise like we're talking about?
Yeah, so this is another area of kind of the fitness industry that's not very clear, and I think it leaves women in this no man's land after they've had a baby. Because the guidelines in theory are that you can restart exercise 6 weeks after a vaginal birth and then 12 weeks after a cesarean birth. But actually every pregnancy is different, every labor is different, and every recovery is different. So, you know, I've been abiding by those guidelines for years, but then I had an emergency cesarean with my daughter, and at 12 weeks, I did not feel comfortable doing any exercise.
Well, so that's so interesting. So it really is a case-by-case basis.
It's really individual. And I think that's why one thing that the UK don't do fantastically, but for example, France are incredible at, is that in France, you get a certain amount of physio after you've had a baby. So
where do you get 10 free sessions or something just on the National Health Service? I mean, what a genius idea, and why are we not doing that in the UK?
And that's a huge amount. Like 10 hours is fantastic. Whereas in the UK, you know, we're supposed to have this 6-week checkup, and actually it's more about the baby. Like I didn't even get my stitches looked at 6 weeks. So, you know, I think it has to be really individual. And also, if you can afford to see a women's health physio, I would get a mummy MOT or a checkup where they can check any stitches. You know, they can do an internal, check your pelvic floor strength before you start getting excited and doing exercise again. If you can't and you think something's wrong, ask to be referred. I was referred to women's health physio, and I was very grateful for that. But also,
I feel like these women's health physios are sort of the unsung heroes in mother. You know, they really help you to put your body back into the right place.
Yeah, you know, there are so many there are so many women, I think we hear that 6-week rule and we think, oh, brilliant, when I'm 6 weeks, I can go for a run. And then actually, sadly, what we tend to see in studio is women who started a bit early and then had things like prolapse, which maybe they'd never even heard of. And so I would say that it's better to start a bit later than too early. There's no perfect time, you just have to listen to your body. But as soon as you've had your baby, and as soon as you've done your first wee after having a baby, no matter how you birth your baby, you can start doing pelvic floor work straight away, so it's not like you can't do anything. You can start thinking about activating your transverse muscle again, which we talk about loads prenatally in our classes. So there are some things you can do straight away that can really help, but just don't get to 6 weeks and then go to a CrossFit class, because
don't forget about yourselves. And I think that's such a relevant sort of point to be made as well, because new mothers obviously will find it very hard to prioritize themselves, particularly as they have a new baby who is taking up all of their time and attention. All of these things aside, how can we also find that time? I mean, as a sort of fairly new mother yourself, how did you find the time to get back to exercising when you had a new baby to look after?
I don't think that I did. I think that I got a real shock, like I said, that actually the recovery felt much longer. And I don't know if it's maybe just that I was more aware that it was too early and that at 12 weeks I didn't feel particularly healed. It's a massive, anyone who has their first child, I think it's a massive shock how much of a time demand those babies are. And actually I didn't get mat leave, so I was still trying to work. So I think it's very difficult. So I don't think I'm the best example, but I can refer to my postnatal clients who do show up once a week, every Friday. They do it while their baby naps. It's 45 minutes that they set aside. And for them, it's just 45 minutes to actually ask themselves, how am I really feeling? And 45 minutes to get their bodies moving, because you have to prioritize it, but it doesn't need to be a huge amount. You don't need to snap back. You need to stay sane. So for them, what they say is that, you're in the same position all day, every day with a new baby, whether they are breastfeeding or bottle feeding, they feed all day. So you're basically holding them all day in exactly the same position, which will not be perfect and it will be not with good posture. And so they just need to get their bodies moving in the other positions that are available to them. So not just in flexion. So I think it is hard, and being okay with the fact that it is going to be very different postnatally, and you might want to get back to doing something every day, and that might not be a reality, and you come second. But I think going into having a baby and knowing that that's the case and being okay with it, taking the pressure off yourself, is really important, because there is no magic answer, I'm afraid.
Yeah, it seems that when I think exactly as you say, 45 minutes once per week, it sounds doable. I don't have children, I've not had a baby, so I can't imagine how difficult it must be to carve out that time. But I suppose on the plus side, all of these classes now are virtual, and that's such a light at the end of the tunnel, considering how previously we would have trekked halfway across town to go and do one of these classes. So hopefully that's also something that's going to stay, and put women who do have a sort of life and a new baby to all juggle and an exercise regime will be able to at least get some more balance that way. Finally, Hollie, before we move on to Selena, can you tell us a little bit about your initiative for International Women's Day? Because it's really cool, and I think it's something that everyone listening can get involved in.
Yeah, so International Women's Day this year is next Monday, so Monday the 8th of March. And the theme this year is choosing to challenge. And when we think of the stereotype that the media kind of portrays of pregnant women, tends to be that pregnant women are really weak, we're really fragile, very sensitive, be careful of the pregnant woman. And that really has transferred into prenatal fitness. It's very cautionary and it's very dull. And so the bump plan is trying to shake that up anyway. But what we wanted to do this year is we wanted to choose to challenge that stereotype and actually show that pregnant women are so strong, so powerful. You're growing a baby. Like, what could be harder than that? And so we want to celebrate that. So what we've been doing is we found that there were no images online of pregnant women looking strong and sweating and looking amazing at working out. So the first thing we did was a big photo shoot with 4 incredible pregnant women, where we got them sweaty and we got them exercising, and they look incredible. So we can start getting those types of images out there. But it all leads up to next Monday, when at 6 p.m. we're hoping to break a world record for the largest online prenatal Pilates class. So we will be streaming over YouTube at 6 p.m. and we'll be asking pregnant women around the world to join us so that we can break a world record and show that pregnant women are incredible, are strong, and that exercising during pregnancy is a really, really positive experience.
And how can people get involved in it?
So we're announcing it right now on our social media, or the marketing team are announcing it for me over on our social media. So our Instagram is The Bump Plan, and my Instagram is The Pilates PT. So you'll be able to read all about it. And then in our bio, you'll be able to head to the landing page, pop your email address in, and you'll be sent all the information. You'll be sent a reminder, you'll be sent things you can download, and you'll be able to get the link for the class, which is next Monday at 6 p.m. So yeah, we'd love everyone to join us, or at least tell your pregnant friends.
Definitely, we'll spread the word far and wide. And thank you so much, Hollie. That was fascinating, and I'm sure really helpful for everyone listening. If you do have any questions for Hollie, please just leave them in the Q&A box, and we'll come to them at the end. So our next speaker is Dr. Selena Langdon, founder of Berkshire Aesthetics and an absolute expert in postnatal body treatments. Selena, thank you very much for being here again with us this evening.
No, I'm really looking forward to it.
Yes, me too. So as a cosmetic doctor with an interest in the female physique, what do you think we can be doing to prepare our bodies for pregnancy? Are there any treatments or sort of techniques that can help to strengthen our anatomy in the lead up to this?
I think, as Hollie was sort of touching on, your pelvic floor is something I think, again, we don't really look after very well as women. I was really lucky when I did my first Beauty Triangle event with you. You had a women's health physio there that day, and she was talking, and she mentioned about how in France it's very different. They get a lot of support. And so we have technologies that we use in the clinic to support patients if they decide that this is something they want to target. It's something I've even been trying myself. I've not had children yet, and actually, it's something I'd ignored and probably hadn't thought about. But we have, for example, we have the Centella chair. It's an absolutely brilliant piece of technology that's used for quite across the board, actually. Men and women can use this system, and it's something completely non-invasive. You can literally just sit on it, and it's using electromagnetic technology to stimulate your pelvic floor. And so in terms of discomfort, downtime, there's nothing involved in that. And actually, if women are thinking about, I want to take myself through to pregnancy, and I want to improve my pelvic floor strength, this is actually a really nice way to do it. Because I don't know if you ever try to do pelvic floor exercises. I try to remember to do them and then I forget, whereas this system is extremely powerful, and it's able to do a lot of pelvic floor exercises for you almost.
What's the equivalent? It's like 30,000 Kegels in half an hour, they say, or something crazy.
28 minutes. It's like really
amazing.
Quick. It's the most unusual feeling when you're sat on it, but you can really feel it working. But I always encourage my patients to exercise with it. So I make them sort of do a Kegel at the same time whilst they're doing it, because I think it makes it a little bit more intense.
Oh, that's really interesting. And how many sessions do you need of the Centella to get the pelvic floor into a good shape?
It's usually 6 sessions. And again, depending on the patient, the issue that they have, somebody might be postnatal and have some incontinence, and that's the sort of reason that they're coming to see us. But if you're doing it in preparation, then 6 sessions, 1 a week would probably be more than enough. And actually at the end of it, you can see a dramatic difference. I think the other thing people forget as well is that your pelvic floor and your core, it's all part and parcel of the same sort of package. So if you are addressing that, you can improve your core through doing it, because the way you're sitting on the chair, it's sort of emitting the energy quite centrally. And actually,
so you're getting a core workout at the same time, aren't you?
And you have to sit quite sort of solid in it as well. So I think it will help to address that.
It's a bit like a power plate in a way, isn't it? I mean, I know it's a very different technology, but for anyone who stood on sort of that vibrating sort of crazy plate, it has that very intense, fierce vibration sort of that runs through your body.
And actually, you know, not everybody can tolerate the intensities. I was on the weakest amount practically, and that's as much as I could take. Whereas somebody who has an extremely, you know, weak pelvic floor could probably take something a little bit more powerful, purely because their pelvic floor needs that. So the level of, you know, it's really customizable, it's very bespoke. And I think patients like that. They like the idea that they don't have to take their clothes off. They can literally sit in a chair. And
it's very discreet, actually. And I'm sure I've seen it in your clinic. It's sort of tucked away behind a nice little partition as well. So you can sit there and read a magazine for half an hour, can't you?
Exactly.
Unless you start getting orgasms when you're on it.
I have heard that this is a side effect. Yeah. Is this true?
It's happened.
How do you deal with the patient? And
we tend to put them in the room and step out.
I'll leave you to it.
I had one lady, she admitted to me, she just sort of said, oh my gosh, this is the most amazing feeling. But you know, I think it's one of those things, again, where you're positioning yourself on it, it will also depend on which part of the pelvic floor you're going to be targeting. So I think it's being sensible about how you can prepare these sorts of things. I mean, we have a lot of other technologies, but I think the things that patients primarily come to me in the lead up, it's either their skin that they're concerned about because they're worried how bad that's going to become following pregnancy or during pregnancy, or pelvic floor is usually one of the sort of primary concerns. But skin, I think, has become a big issue as well. We've sort of learned how to manage.
I think you're right with skin, actually, and it's sort of one of the last things that people do sort of tend to focus on, because I think you're right. You're thinking of your body, your stomach, your core, sort of how that's changing, but actually that the skin, the sort of external covering, comes under so much stress, you know, as the body does grow. I guess things like stretch marks, that sort of loss of elasticity, are those all the things that women are looking to prevent then?
Definitely. Stretch marks probably the biggest thing, but acne actually as well. Acne is something that we see a lot of, purely because patients, they're petrified. We do a lot of you know, skincare for patients with acne. The minute they become pregnant, that has to completely change because of the treatments that they're on. You can't give them half of the medications that you were previously using or anything that's terribly aggressive.
Or women who have come off the pill, you know, maybe people who've been using it to manage acne for such a long time. They can't do the prescription skincare, they can't do the pill, and it all goes to pot.
Exactly. And we're lucky. We made sure, and actually it was something that I looked into really thoroughly. I wanted skincare lines that I could safely use in pregnancy and breastfeeding, because you have to be so careful. We've specifically got brands that we can work with that are non-systemic. We know that they're not going to cause any harm. You know, again, there's actually vitamin A is something that a lot of people are very fearful of during pregnancy, for the very right reasons that they should be. But actually, there are some brands that have developed non-systemic topical vitamin A's that can be used, for example, on your tummy if you wanted to stop yourself from getting issues with stretch marks.
That's really interesting.
You've got to kind of obviously be mindful. They've done a lot of research. You have to look into their sort of, you know, all the research that they have to be able to prove that you know, the products are safe. But there's a lot of things that you should you know, be doing in terms of, especially if you're preparing the skin on your abdomen. If you can at least protect that skin before you are, you know, heavily pregnant, doing a massage, using a good topical product, it can help, and it can at least help to strengthen the skin and support it. It's saving you having to do a lot of treatments afterwards when your stretch marks become really bad.
Exactly, it's almost that damage limitation before you even get to the pregnancy itself, I suppose. When women do come to then see you then postnatally, so after they've given birth, or even in the years following having their family, what are the common issues that they're looking to treat?
Usually, I mean, it's going to be a pelvic floor issue, or it's the pouch that's left behind after their C-section, which I think that's primarily a lot of what women come to see me for, and also stretch marks. Those are the main things.
And all of these are things that I'm sure have sort of huge emotional repercussions, as well as just being a bit of a bother physically.
Because I mean, you've had this wonderful thing, you've had a baby, and the same time your body's completely changed into something that you don't recognize anymore. And it's not, I always say this, I really hate the word vanity. It's not about vanity. I think women just want to feel like themselves again and feel confident in their bodies.
Absolutely.
And I think they just want to have something that's going to help them along. They're not looking for a miracle, but they want something that's going to give them that little bit of confidence again. And actually, there's a lot of really effective treatments. I mean, stretch marks, we tend to, we have a couple of different modalities of treatments. Again, depending on skin type, darker skin tones, we have to be a little bit more careful with, just because there's more issues in terms of pigmentation that can develop and things, so we have to be mindful of that. We tend to use lasers, so we have a really fantastic laser that works really well for treating stretch marks. It's called the Resurfex. It's a non-ablative laser, which means it's not removing skin, but it's really good at healing the stretch mark and improving the quality of it, especially when they're like that silvery texture to them and they look very shiny.
Yeah, exactly.
Them, not when they're still very red. Sometimes when they're very red in appearance, you still have to treat the redness in the stretch mark first before you can address it a little bit later.
And how do you treat the redness in the stretch mark? What advice do you use there?
It's either you might use a little bit of IPL, something on a vascular setting to try and reduce that redness, take some of the inflammation down. So again, it depends on what stage they are having, delivered and how safely you would want to sort of start treating somebody.
Yeah.
But microneedling is really fantastic. Again, if somebody even presents with quite old stretch marks, you can do basic microneedling, or you can do, we have something like Morpheus 8, which is fractional radiofrequency microneedling. So we have different varieties depending on the patient, the skin type. So lots of ways that we can address it.
The fractionated radio frequency has been in the press so much recently with Judy Murray, and everyone's seen that sort of amazing transformation in her skin quality. And I think you're one of the only clinics in the UK that sort of can deliver that with an even sort of deeper sort of treatment head to the body, aren't you?
We've got the body tip, and it was they developed it specifically. They wanted to keep it as safe as possible, so it's not been launched into every clinic just purely because they want somebody who knows what they're doing with it, because it can treat at a very deep depth, and you do tend to need injectable anesthetic for that. So they wouldn't want just anybody using it because it could be very painful. So
and neither would the patient, quite frankly.
So we have that tool as well. And I guess actually, even coming back to diastasis recti, that's something else that we often see a lot of patients coming to talk to us about. I remember now, we're a big core sculpting clinic, and a lot of patients will come and have had their baby. They might have had a C-section, and they say, I just want to get rid of this little pot belly, this little pouch is like an overhang. Their C-section scar might be really tight. It makes it more emphasized. And actually, when I examine them, I say, well, actually, this might be more to do with the fact that you have quite a decent diastasis recti there that could be treated and actually improve the appearance, because very often when the pelvic floor, your abdominal wall is very weak, it gives the appearance that you've got a pot belly, and it isn't. It's just that you've got to strengthen that wall.
Oh, that's interesting. So you sort of need to sandwich Hollie's sort of Pilates techniques with your sort of M sculpt or M Zella for the muscles, and then I guess the final icing on the cake would be like a core sculpting to then address that sort of unwanted fat, I suppose, on the stomach.
Yeah, and it works really nicely because, again, they're all very bespoke treatments. We have specific size applicators that can treat. So if somebody's got a tiny little pocket, they don't want to necessarily go down the surgical route yet, this is a nice treatment that you can use because it can just tidy it up. I mean, there's a very nice way that you can almost flatten where the C-section scar is, to tuck it up so that it looks just in harmony with the rest of the tummy. And if you combine that with M-Sculpt, you've got again a really powerful electromagnetic technology that's used to really cause your abdominal wall to contract again extremely powerfully.
And the M-Sculpt's quite easy as a patient. This is one that I've tried, and it's very much just the paddles that sit on your abdomen, and again they emit that very intense sort of vibrational feeling, and it's one that you can certainly dial up, and I certainly couldn't get to a particularly high number on it, but it's certainly tolerable. That there's no real pain involved, I wouldn't say, with any of these muscle stimulating devices.
Although having said that, if somebody had an emergency C-section and they had a very difficult time, you would tell them to wait at least sort of 6 months before they consider doing something like that. Because again, a little bit of scar tissue, I have found in some patients who are having M-Sculpt, the scar tissue can actually be quite sensitive, and they find it a little bit uncomfortable. So you have to be mindful of that.
Do you think that by doing the sort of at-home massage and, I don't know, maybe some manual lymphatic drainage sort of post-pregnancy, post-cesarean, that you could encourage the scar tissue to heal in a better way? Because we often say scar tissue is when all of the collagen fibers heal in a very haphazard way, whereas if you can get them to heal in a very smooth and organized fashion, then the scarring is much less, isn't it?
Definitely. And I think all of these things, it's all combination treatments. There's never a sort of one size fits all approach. Just being sensible, again, not rushing into things, only do these things when you feel comfortable. And scars as well, you know, we have a lot of patients that come in because they just want to address their C-section scar. They find that it's become too lumpy, it's quite obvious. Again, different treatments are appropriate for that. It could be microneedling, it could be laser, it could be steroid injections. It just depends on skin type and the person sitting in front of you and what's going to be appropriate for them. And pigmentation actually in scars. Some don't have a very thick scar, but they've got a highly pigmented scar and they want to have that treated, and it's very obvious and they want to, you know, improve the appearance of it. So there's lots of different things that we tend to target depending on, you know, the person and what they're worried about.
And you said wait 6 months if you've had a cesarean, but how long do you have to wait to sort of dip a toe into these non-surgical, non-invasive treatments if you've had a sort of standard pregnancy?
Again, I think it's very individual. It just depends on when you feel comfortable to have the treatment. With something like Emsculpt or Emcella, because they're completely non-invasive, you might find that within a couple of months you might feel comfortable to have a treatment like that, depending on if you have the time to fit it in, all that sort of stuff. When it comes to sort of incontinence treatments, I have some patients who they have had a vaginal delivery. They want to try something like UltraFem, which is a slightly more invasive treatment because you're inserting a vaginal probe to perform that treatment.
Exactly. And so maybe that feels like one step too far for people who are still feeling quite, sort of fragile.
Yeah, and it's an uncomfortable treatment to a certain degree. It's not painful, but if you'd only recently delivered, you certainly wouldn't want to be having that treatment, that close together. So again, I would encourage you to wait sort of 3 to 4 months until you feel things have started to go back to where they were. And that's a really fantastic treatment. In addition, you can actually combine Emcella with UltraFem and target your pelvic floor, but also targeting the actual walls of the vagina, the vaginal canal. That in addition, all that extra tightening, all that heating up, improving the quality of the tissue, that in itself is just as important for some patients. But I also have a lot of women who, after pregnancy, they want to treat the appearance as well of the outside of the labia. And that's partly what UltraFem allows you to do, because again, it plumps up the tissue, it stimulates collagen and elastin. So there's, again,
the skin quality is so much better and smooth. I mean, often we talk about recognizing, I suppose, the limitations of a lot of these treatments that you're talking about as well. At what stage, when you're sort of presented with a lady who is postnatal, would you decide that actually the best course of action was to refer them to a surgeon?
I think it's just about setting sensible expectations. Non-surgical treatments are fantastic, but they're not for everybody. And there's, Jackie's going to talk to you about this shortly. There are lots of, indications for why a surgeon would be the most appropriate person to see. And that's if you find that, they've got especially a very big overhang from where their C-section has been, if they've got a huge number of stretch marks to the point where the skin has become, really compromised, or they're carrying a huge amount of excess fat as well. If they're also expecting, a non-surgical treatment to be able to resolve all of that, then that's actually not, something that I would be comfortable doing. So I would say at this point, you are going to be better to go and see a plastic surgeon who can address all of this, because actually by the time you've probably done all of these, non-surgical treatments, the cost is going to really amount, and you're going to feel disappointed at the end of it. So you have to again set realistic expectations. Again,
it's true.
Yeah, exactly. And if somebody came to me from an incontinence point of view following pregnancy, and that was, really having a huge impact on their quality of life, and it was making things very difficult, and there isn't really a non-surgical treatment that can treat that, that's when I would say you're going to need to see a urogynecologist. They're going to have to address that. Potentially there might be a surgical procedure that's required there, or medication. So that I'm very lucky. I have some really amazing people, surgeons around me that I very happily refer to. And we're all very sensible. If there's a patient who's really keen not to go down the surgical route, they come to me. If they want to see a surgeon, then I'm always really happy to refer on.
I love the fact that, and I know Jackie will say the same, but that you and Hollie both do sort of refer on to other people as well, because again, I sort of think about postnatal as being, you know, that you need a bit of a support team around you, and sometimes you do need to rely on the experience of others as well. So that's brilliant.
It's just understanding your limitations. I think, you know, I can't wave a magic wand on every single, you know, patient that comes through the door, and so I'm very sensible. If I feel that I can definitely help, then I will. But if I think that it's not my field and it's not appropriate for me to be doing so, then I always refer on, because ultimately the only person that matters is the patient. And as long as they feel comfortable and happy, they then may come back to you for something else, you know, post their treatment. There's nothing to say that they couldn't have a surgical treatment and then require some sort of non-surgical for maintenance. Because
that's true, and these procedures often do go hand in hand, don't they? Maybe the surgery is the first thing you do, and then you're just maintaining it, exactly as you say, non-surgically.
Exactly, and sometimes I might just see patients who've had surgery, but they just want to have their scars looked after, for example. So it all goes hand in hand, and I think it's about having a good partnership. If you're very lucky and you have good colleagues around you, you can all offer a very, you know, really holistic approach to that patient, and they're very grateful.
I completely agree. It's all about holistic. And Selena, thank you so much for being a part of tonight. Really, really interesting listening to everything you had to say. And if anyone has any more questions for Selena about the treatment she mentioned or anything non-surgical at all, then just jot it in the Q&A box. So our final speaker is Mrs. Jacqueline Lewis, or Jackie, as I refer to her. I think most people do. And Jackie is one of London's most sought after surgeons when it comes to the breast and the body, particularly postnatally. Firstly, Jackie, thank you very much for being with us.
Lovely to be here. Thank you for having me.
Not at all. Maybe we can sort of wind back, rather than talking about surgery as what comes after the pregnancy. What about those women who are yet to start a family, still planning their pregnancy, but who are maybe considering a surgical procedure like a breast enlargement? Is there any advice that you would give them?
Certainly, when I counsel women who want any sort of breast surgical procedure, I say that decide what you want to achieve, whether it's the right time in your life, because if you are going to get pregnant and breastfeed, your body will change. I mean, for some, having your breasts enlarged by 2 cup sizes is a blessing, and I certainly looked forward to it because I was a AAA cup size, but that's a different story. But for someone who's very large already and who's probably wanting a breast reduction, maybe it's a good time to have it done before pregnancy, although then they might not be able to breastfeed. So it's always individualized what someone wants to achieve and why they want to achieve it.
Interesting that you talk about breastfeeding as well, because that's certainly a question that I feel comes up quite frequently when it comes to pregnancy and surgery, you know, particularly breast surgery. And what impact does a breast augmentation, particularly implants, have on a woman's ability to breastfeed further down the line?
So if you think about inserting a breast implant either behind the breast glandular tissue or behind the muscle, none of that should disrupt the breast gland itself. It really depends on the incision. And the only incision that may go through the breast tissue and cut the ducts is the periareolar incision. So
that's when you're sort of taking the nipple away and then trying to do it through the nipple. It's quite an involved procedure.
So it's a common, well, it used to be commonly used in France, even though they go around topless and show their boobs on the beach. That was a very common incision to use around the area. You
then wouldn't have the scar because it would sort of be hidden in the outline of the nipple.
Yes, but in most other countries, we use the inframammary or put the incision in the crease beneath the breast. And I favor that incision because I know that breast implants won't last a lifetime and you'll need to have them exchanged every 10 to 15 years. And that is the best access incision. But usually women can breastfeed after breast surgery, breast augmentation, because you're not going through the ducts or damaging the breast tissue.
And you had, oh, sorry, no, you carry on. I've got another question for you, but I'll wait.
Different if you have a breast reduction, because depending on how many ducts are left attached to the nipple, depending on the technique, if you have what we call the central mound or inferior pedicle technique, the back of the breast and the bottom bit of the breast is still attached to the nipple, and so there are some ducts still attached, and so that portion of breast tissue potentially can still produce milk, and it's connected and it will come through the nipple. But if you have a different technique where you actually take the whole nipple areola off the breast gland and have it attached in the upper or by the sides, then most of that connection is gone. And I normally say, if I use the technique that allows breastfeeding in some women, up to 1/3 of women aren't able to breastfeed anyway without surgery. So this is something to take.
That's true. It's definitely something to bear in mind. And, you know, we can all have all of the best will and want to be able to do this. And obviously it's not always the case for everyone. You did have some tips earlier just before we came on to do this live about how to make breastfeeding easier. I think probably from your perspective of being a mother as well yourself. Maybe you can share those with us because I found them fascinating.
So I had the most sore nipples ever. I mean, with my small breasts and lack of glandular tissue, my babies were always hungry and I was always breastfeeding, and they used to suck like a Dyson vacuum. So much so that I had cracked nipples, my papillae were going black because they were sucking so hard. But sensitive nipples, as soon as you become pregnant, you will probably notice that your breasts are very sensitive and sore, and more so your nipples. So one of the best tips that I got from one of my friends, and it sounded crazy when she told me, is to desensitize your nipples. And the way to do that is after every shower, rather than using your softened towel, your white fluffy softened towel, get a towel that you have put through the washing machine and dry, or even not through the dryer.
So it's all really sort of
dry, so that it's really stiff, and use that to desensitize your nipples after every shower, as soon as you know you're pregnant.
That's very interesting, and it obviously makes a difference then.
Oh, well, I think it really does make a difference, because you are so sensitive anyway, and you just need to desensitize it, and you've got the whole 9 months to start doing it if you know when you're pregnant. But the other thing is, support your breast. I know it's fashionable and it's actually healthy to not wear a bra, but if your breasts are going to swell up, can you think of the amount of drag on your skin? So do support your breasts when you are, especially in the 3rd trimester, because the weight of it. And certainly when you're breastfeeding, do support your breasts and wear a really comfy, supportive bra. And you probably will feel that it's tight around your chest, because that uterus the womb is pushing up against your chest and everything is feeling really tight. But, you know, get a really nice elastic, supportive bra, get a bra extender on the back with lots of hooks, and do support your breasts.
I think that's a very important tip. And also wear a good fitting sports bra if you're bouncing around doing all of the exercises that Hollie suggested as well, or not bouncing around, doing the low impact cardio. And now, Jackie, you're a really big believer in fat transfer, which I always think is the most elegant solution to sort of redistributing the fat in the areas that we don't really want it in to those areas in need. How do you most commonly use this when it comes to postnatal women?
A lot of women, after they've finished their family, and if they've had lots of children and breast them for a long time, the breasts will deflate. And there are so many women who say, I just want a little bit of fullness up here because you've lost all the tissue. So even with implants, if the breast footprint has fallen down on the chest wall and you put implants in, and even if you do a mastopexy and tighten up the skin, it's this area here that lacks tissue.
I can't see where you're pointing.
So it's just the junction between here and here.
Thank you.
Especially if your breast footprint has dropped. So one of the nicest ways of making that look natural is to put some fat underneath the skin here, especially if you've got a very thin lady with no tissue, and if their breast footprint has lowered on their chest wall. So yeah, we liposuction fat from the thighs or the hips or the tummy. And this is why I get myself into a tiz if someone has said that they've had cool sculpting or radio frequency. I said, oh no,
get rid of all
that liposuction. Oh my goodness, no, you could have had it, you could have worn it up here.
That's very funny. And once the fat's removed, can it return to the area that it's been taken from?
Really good question, because this is what I get asked all the time, and there have been lots of studies and papers written on it. When you liposuction fat away, the remaining fat cells can either grow bigger if you put on weight, or if you, in certain areas, give them a lot of energy and put on a lot of weight, in some areas they can multiply. So in and around the tummy and the flanks, and in some areas of the thighs, if you take the fat away, it doesn't tend to, those cells don't tend to multiply. But if you, in the saddlebag area, if you overeat, for example, there was a study saying, if you overeat for 6 weeks before liposuction and you want fat for transfer, you can use the saddlebag area and you can actually grow those number of cells.
So it's enough just to overeat for six weeks and the fat will naturally go to the saddlebags? What if you don't stop there?
It depends on what you start off with. It's your baseline level, but potentially the fat around our body, even in the subcutaneous layer underneath the skin, acts differently.
It's very interesting because, yeah, you're right. We often worry about sort of very slim women and they want to do the fat transfer, but where do you take it to? So good to know there's a technique that enables us to, you know, get that fat if that's the issue.
Yeah.
Lovely if that is the issue. One of the other things I wanted to talk about was the concept of mummy makeovers, because I think it's a term that's sort of often thrown around in the post-pregnancy world. What exactly are these? And I suppose when is the best time for a woman to consider having them after her baby?
A typical mummy makeover is a boob job, where whether it be implants or skin tightening or a combination with a surgical, what we call abdominoplasty or tummy tuck. So it's really all well and good if you haven't got that much of an overhang and skin laxity after giving birth. But from personal experience, I'm 5'2", very narrow hips, and all my baby was out the front of me. I mean, I was like up to here. I could have drunk my tea off my abdomen in the later stages. And because I've got a really short torso, everything came out. And so my recti, the abdominal muscles, were completely split. Way, no way of exercising to getting them back. And I waited for 8 years, no, 32 to 40, 8 years, trying all sorts of exercises and non-surgical things. And then I thought, no, I need to have the abdominoplasty. So in those days, well, I think I told you this before. I had my tummy up here.
Yeah.
So I had my boob job from my own tissue using.
Yes, you did tell me this. It's actually it became very sort of elegant.
Abdominal DIEP flaps. So this is what's normally used in reconstruction, but rather than throw the tissue away, I thought, maybe I won't have implants, I'll just have my own fat. So that's what I had. So that was the ultimate mummy makeover, but it's much easier to use free fat transfer and or implants.
Agreed. But what an amazing solution that you found for your own needs as well. So, it's just a very bespoke sort of application, isn't it, that these combinations?
Yeah, so timing wise, when to have it after you've finished your family, because if you've cut away the tissue in your abdomen, you don't want to overstretch what's left, because then you'll certainly overstretch it.
No, I think that's really, really wise. Final question before we sort of wrap up. We often talk a lot about the importance of aftercare with any surgical procedure. So I guess things like supplementation, manual lymphatic drainage, scar management. How important are all of these things following sort of a mummy makeover or any of the procedures that you might be doing for somebody postnatally?
So, you know, the way Hollie was saying, prepare before you get pregnant. Before an operation, start preparing. Proteins and nutrients are the building blocks for healing. You want ultimate healing. You don't want wound breakdown. You want really good scars. So start from way before you even consider having surgery. I use collagen supplements with nutrients. A really good program is the Skin Aid MD, which is that prescribable nutrient program with collagen, and they have goodies in it which reduce scarring and bruising and all sorts of lovely things. But also protein in your diet before the operation, protein at every meal, I normally say. Certainly prepare with good compression garments and bras if you're going to have liposuction and support. And if you have a tummy tuck, you'll need to wear a compression garment as well.
Yeah.
Aftercare, if you can afford it, 14 days of manual lymphatic drainage massage. In Brazil, everyone has it. In this country, I don't know why we never recommended it. I certainly say to my ladies, invest in it, because the swelling goes down, you feel good in yourself. It's amazing.
And also I think it eliminates that fear of your body again, and sort of, you know, whether it's post-pregnancy or sort of post-cesarean or post one of your surgical procedures, we need to become familiar and comfortable with our body and sort of managing it again, I think.
And post-op wound care, taping, occlusion, silicone gel, bio oil, and then at certain stages after, like 2 weeks after, if you're fully healed, massage will really help. And it's localized massage on the scar really, really helps. And inevitably, some people will make bad scars, and then we send them to people like Selena, who has got all her lovely devices, microneedling and laser and IPL and everything for the different scar management. But yeah, start from within and start beforehand. So question to you ladies, while you've been listening to me, how many of you have been doing your Kegel exercises?
I've been more focused on like staying on top of my questions. I haven't had a moment to think about Kegel exercises, but you have got me thinking about, you know, starting all of these things. I think it's wise to be prepared, isn't it?
So when you're waiting for the tube, when you're waiting at the bus stop, don't just stand there, do them. But
very helpful.
Can I say something about the Centella chair?
Yes, please. You've been on it, haven't you?
I had 2 ventouse suction deliveries. My pelvic floor and my perineum wrecked. Oh my goodness. And I found that doing jumping jacks years after pregnancy, I had a little leak. Oh my goodness. But this was only after the menopause, because your body changes as well.
That's interesting. So it only kicked in at that stage.
Centella chair, amazing. And the other amazing thing is Vivive, the radio frequency for the vagina. But
I love it. You actually have guinea pigged all of these things.
Centella chair, how can you achieve supramaximal 11,000 contractions in 28 minutes? You'd never achieve it. Even
they need to start selling them for at-home use. I mean, they'd be so wildly popular.
Even with your Kegel, you're only exercising 30 to 50% of that muscle, whereas with the Centella, it's 100%, 11,000.
Oh, it's amazing. I don't know enough about the technology, bar, you know, the treatments I've had done, but I think, you know, it really encourages the entire length of the muscle to work, doesn't it? Which is really interesting. I'm sure.
So if I could prescribe it, I would prescribe, you know, one treatment. I
was going to say, you don't even
every year.
I think that's the nice thing about it. The maintenance is not terribly difficult. You can sort of do it as and when you need to, so you can keep it popped up. And then just keep on top of it, because you could have a one-off session every like 6 months or something, and keep on that way. So it's not, there's not a huge amount of commitment required.
It can sort of become a part of your bi-monthly MOT with all of the other bits and pieces you're doing.
Yeah, no, I'd prescribe it.
That is good to know. I think we'll all be taking you up on the Mzella at some point. Thank you, Jackie. Thank you so much for sharing all of your wisdom with us. That was brilliant. So I think that brings us to the end of tonight's discussion. And can I just start by saying a huge thank you to our amazing panel. I think we can all agree after listening to these ladies speak that pregnancy is definitely one of the greatest periods of physical and emotional growth that we go through as women. But as our bodies change, so do our needs, so do our expectations, and also so do our mindsets. So I think for these reasons alone, coming together to have these discussions can be so beneficial, not just to give us a positive perspective on what the journey looks like, but to also realize that we're not alone in going through this next chapter. Before we finish with a couple of the audience questions, can I quickly remind you that when you leave, there's a short questionnaire for you to fill in. It's so we can send you a helpful recap of everything that we took away from tonight's webinar, as well as helping us to connect you with Hollie, Selena, or Jackie, should you like that. And don't forget to leave your address if you haven't already, because it means that we can send you a sample of Sisley's new intensive contouring care body cream, which I've started using already, and it's amazing. So I can vouch for that you will want it. Let's go over to the questions.
I see one. Does breast size often return to pre-pregnancy size?
God, you're amazing. You can just do this part for me. Well, that's definitely a question for you, Jackie. And also, well, I'll break it up into the two. Yes, tell us the answer to that one first.
So yes and no, and it really depends on what your pre-pregnancy size is and what your body weight is afterwards. But one thing that may not go back to normal is the elasticity of the tissue. And so the suspensory ligaments that hold your skin to the chest wall will be stretched with your increase in breast size, and so they will droop. When is the best time to have a reduction post-pregnancy? When you've completed your family and you're back to normal. So I wouldn't normally like to operate on anyone within 6 months of stopping breastfeeding, preferably a year, because that gives your breast glandular tissue time to settle down, for you to take your time to get back to your normal weight and to get your energy levels back up.
Perfect. I think there's just one more that's popped into the question box.
For Selena.
Is there, there's one for Selena, but let's just carry on with you quickly whilst you've got the floor. Is there a relation between breast reduction and not producing colostrum? Thank you.
It depends on whether or not there's a connection between the nipple and the ducts and the breast tissue. So colostrum is just the start of the milk production. And so if there is a connection and you're going to be able to produce milk, and there's your body will produce it, and it has an outlet through the ducts and the nipple, you can produce colostrum and breastfeed. But if there's no connection and the ducts are cut, then you can't.
Very helpful.
Does that answer it?
Perfect. I hope so. If you have any further questions, to the lady who put that in there, just drop them in, and Jackie will be here to answer them. One for Selena. This is a bit of a long one, so bear with me. I'm 36 years old, 13 weeks pregnant, and would usually use a Bargy 0.05% topical tretinoin 3 to 4 nights a week. I stopped using it when I found out I was pregnant, but feel I'd really like to restart it as the fine lines that it was treating are starting to be not so fine. I feel your pain. I have been doing some research, but I'm not sure whether it'd be the right thing to restart it. Do you have any advice, any alternatives? She's also using HA in the evening and SPF 50 during the day, which is amazing. And she's cleansing, toning and moisturizing morning and evening. I mean, she sounds like she's doing absolutely everything by the book. So what do you think, Selena?
Topical tretinoin is a no. That's the one type of sort of a retinoid or a vitamin A that we would recommend whilst you're still pregnant, and actually even when you're breastfeeding, we would say not to do that. If you are looking to substitute it, there are, as I said, there are some topical vitamin A's, so they are derivatives of vitamin A, slightly more inactive forms, things like retinol palmitate. They're not systemic, so they're not going to be absorbed into your bloodstream. So there are certain brands of manufacturers within sort of the cosmeceutical lines that are
safe to use. The difference is that you get pharmaceutical grade versus cosmeceutical grade, which is cosmetic. Cosmetic grade is seen as safer because it can't absorb into your bloodstream. So tretinoin, which you're using with the Abaji range of products, that is a pharmaceutical grade product. So definitely, as much as the temptation is there, it's not worth the risk, because that in itself that would not be safe to do. Switching yourself to a cosmeceutical type product would work and could be, you know, it's not going to be as effective as a topical tretinoin, but it will certainly help to kind of just keep things sort of ticking over. The other thing you can incorporate is a really good vitamin C, a good L-ascorbic acid, because that again is very nourishing for the skin. It works really well. It's got lots of antioxidants in it, and again can keep your skin ticking over. It's really tricky. There are a lot of people that struggle with their skin during pregnancy because they had it under really good control. All of a sudden they're pregnant. They're not able to do all the things that they wanted to do. But actually, even in some of the Abaji products now, Susan Abaji, who was Dr. Abaji's daughter, has released a range of Abaji products now called Susan Abaji MD, which there are products within that range that are safe in pregnancy and breastfeeding. So there are some really good quality ones that you can use.
So Abaji is a good range to look at, even if you are pregnant. But I guess also just to check in with your aesthetic doctor, just to make sure that you're taking the right thing.
You have to be doubly sure that you're picking exactly the right ones. You've got to just be really careful of the ingredients and how they're absorbed into the skin. So it's mindful just to make sure that you checked in and you know that you're safe to use that particular one.
Perfect. I'm going to jump over to one of the ones that came in for Hollie just before the webinar. Hollie, what's the basic equipment that you need to start doing Pilates at home? I mean, for all of these women who are doing, your workouts virtually now.
Yeah, so the amazing thing about Pilates is you've got so many different options. So we've got mat Pilates, which is quite literally you just need a yoga mat, and you're using your body weight as resistance, which I think is often forgotten about. But you might have a pair of dumbbells lying around the house that are 2 or 3 kilograms. But if we think of how much our bodies weigh, actually, they can be much more efficient. So you can do mat Pilates, and then, before our studios closed during lockdown, we've got a reformer machine, you've got Cadillac, art barrels, all sorts of things. So, but with our virtual classes, you just need a yoga mat. If you're doing the bump plan, you are sent everything that you need. So you're sent a resistance band and a Pilates ball, just because that extra resistance can really help target muscles that are a little bit tricky to get to. But yeah,
I love you've made it really easy for everyone. We'll sign up, we'll send you the stuff you need. You don't have to leave the house, just get going.
Yeah, we just didn't think through how many we'd be sending and how long.
Bless you.
But yeah, you don't need anything basically.
It made me really laugh sort of during the first lockdown when we all started doing at-home exercising, how inventive people got. I mean, with sort of hand weights, I was definitely using bottles of wine at one point, which was and then we drank it all, so I had to find an alternative. This is a question for Selena. What can I do for stretch marks right now? I'm 32 weeks pregnant and they've just appeared all over my sides and boobs. So I suppose, when someone's pregnant, what are their options? I mean,
it's just even sort of Jackie had mentioned, just doing good massage, using, even I don't normally recommend any particular brands, but, bio oil, for example, anything that's just going to be safe to massage over the sort of area. We do carry some sort of topical body lotions that are slightly more, they're not just cosmetic, they are the sort of cosmeceutical lines, again, safe to use if you're pregnant and breastfeeding, just with some sensible ingredients in that just improve the elasticity within the skin, keeping it as toned as possible. There isn't a perfect solution, unfortunately. As I said, you can't border into pharmaceutical grade products when you're pregnant, but at least using something sensible and just being on top of it. Make sure you do it every morning, every evening, and just start early with, keeping on top of the changes in your skin. And as soon as you feel that you're happy once you've delivered and, you're not breastfeeding anymore, then that's the right time to intervene and start treating them a little bit more aggressively, because then all the other treatments are open to you at that stage.
Yeah, that's
Selena, do you have any experience with Centella Asiatica?
It is. So
stretch marks.
What's Centella Asiatica?
It's an ingredient in some of our cosmeceutical range products. IS Clinical is one of the brands that we have. Again, they're pregnancy and breastfeeding state. They have that ingredient in quite a lot of their products, actually. It's just, again,
It's meant to help, again, improve elasticity, the tone of the skin. So it's safe because it's not going to interfere if you're pregnant at all. So it's just, again, looking at the ingredients, breaking them down. If you're not sure about the ingredients, just contact your local cosmetic doctor, you know, depending on what ranges they have, and they can tell you. I have a lot of people send me questions about products, and I will look at them very clearly and see whether I think it's safe to use.
That's amazing, yeah, because sometimes you really do need to be a doctor to decipher all the ingredients that are going into these products. And also everyone who's obviously tuning into the webinar will receive the Sisley intensive contouring care as well. And I only started using it today, and I'm not sure if it's necessarily beneficial for stretch marks, but it is, I can tell by the application, it's certainly very good for the elasticity and skin quality. And it's also very sort of invigorating, sort of like a very cold gel. So I'm hoping that's going to have a lovely skin tightening effect. So hopefully everyone will see some benefit from using that as well. One more for Hollie, and then I think we're all done. Is the bump plan suitable for several years after pregnancy, or do you recommend following one of your normal Pilates programs?
So the bump plan is prenatal. Yeah. So the bump plan, I'm presuming that this person is saying that they're postnatal.
I think this is a question that came into us on Instagram.
Yeah, so the bump plan is prenatal. So basically that's, I recorded that whilst I was pregnant with my daughter Freya. So as you get more pregnant in the videos, I also get more pregnant in the videos. And so we're always at the same stage of pregnancy. Whereas postnatally, there is a postnatal version of that in the workings, but the bump plan took 2 years to make, so it might not be that soon. But I teach a postnatal Pilates class every Friday. Now, a question I get asked a lot is like, what constitutes postnatal? You know, some people will come to the class and they'll say, oh, embarrassingly, I'm 18 months postnatal. And I actually think that you're always postnatal. I think once you've had a baby, your body has changed for forever.
That's
and so Jackie's nodding. Your body never quite feels the same again, but that doesn't necessarily have to be a really negative thing. So it's never too late to start exercising again postnatal. It doesn't matter if it's been a few years. But I would say if you haven't exercised since having a baby, definitely start postnatal. And in the classes, I talk about how you can tell if you're safe to move on to regular classes. And it is usually around abdominal separation, or how well can you control your core strength. And I would say if you're still having any leaking, so if there are any pelvic floor issues, I would still start with a postnatal class as well, because that might help, and then also give you the tools to do other classes that are maybe more fun.
And I guess doing all of these things sort of throughout the pregnancy and then postnatally again is just bringing that body confidence back as well, and making sure you're sort of in touch with your physique, and you feel confident and you feel good about it at the end of the day, physically and emotionally.
One thing that did come up that I wanted to quickly jump in was going back to when Selena was talking about cesarean scars. One thing from experience is that if you're pregnant right now and that's the way things end up, don't underestimate the emotional relationship you might have with your cesarean scar. So lots of women find that especially if it was through an emergency cesarean, actually they can't even look at their scar for a long time, let alone touch it. But
that's so true, because I suppose for so many women that have that emergency C-section, it wasn't their plan, and maybe it's a reminder of what they had anticipated their pregnancy and their birth to look like.
Yeah, and if you've never had surgery before, you know, it's big surgery, and all of a sudden there's a scar there and you're not sure how delicate is it, am I going to burst my stitches? So you tend to find there's lots of postnatal women who are months later won't even touch their scar. But actually, if we can get scar massage in there quite early, then we're less likely to have a buildup of scar tissue, that overhang or that pooch that with pregnant women, postnatal women often talk about. So I think that, you know, no matter what labor you're planning, you never quite know how it's going to go. But know that postnatally, if you can start getting used to your scar, start touching it, even if at first it's just a bit weird, you know, the more you touch it, the more you get used to it. And massaging a scar can have a massive difference on your recovery and then how your scar looks postnatally. And stop, hopefully, that overhang that postnatal women do get very self-conscious of.
Agreed. I think that's a really important point. I mean, Selena, just a question from me here. Do you see a real difference in the emergency C-section scars versus the planned C-section? Because obviously they have been done so much faster if they're done in an emergency.
Well, I think, yeah, obviously the job of the surgeon at that point is just to get the baby out safely and keep mummy as well as, you know, as much as possible. So it's the difference is that they tend to be extremely tethered. They're not perfectly straight. They're slightly wonky. There'll be one area that looks completely different to the other. So I think they often find a lot of women will just feel that you know was not. They just didn't expect it to look like that at all. And actually, how tight they can be as well. They can really be, you know, very tethered underneath, compared to somebody who's had a beautiful one, you know, from, you know, hidden inside their bikini line that you can barely see, very faint, really neat. So there can be massive variability. And again, it's skin type. You know, some patients, their skin type will always scar a lot more. So darker skin tones will get much more hypertrophic scars, much more noticeable scars. And again, if they'd had any wound breakdown or anything like that when they were healing, you know, they can get really sort of obvious contour irregularities as well. And it can be very, you know, upsetting for certain patients, because it just, I was just said, you know, if they weren't expecting that to be what was, you know, in their plan, a really ugly scar is difficult to sort of, you know, get your head around sometimes. But there are lots of treatments now. You know, not limited to certain, you know, there's a lot of availability in terms of scar improvement.
I think what I've taken away from listening to all of you is that you can prepare for pregnancy till the cows come home, but maybe you need to relax when it comes to exactly executing that plan of how it's going to look. And yeah, if it doesn't go to the plan that you had envisioned, then at least there are ladies like you around to help us come to grips with it all. So I think that's it for the questions, and that very neatly brings us to the end of the webinar. A final big thank you to our beauty triangle, to Hollie, to Selena, to Jackie for being with us and dispensing all of your fabulous tips and advice, which I think has been extraordinarily helpful. To our audience, thank you as always for being with us. It's been great to have you, and I hope you found tonight helpful. As always, we'd love to see you at our other events and webinars. So if you've not already, please register your details on our website, thebeautytriangle.com, and we'll keep you in the loop with all upcoming activity. Ladies on our panel, maybe you want to say a quick goodbye to everyone before we sign off.
Thank you.
Even just a wave. I want to give you the opportunity. Enjoy the rest of your evening, everyone, and thank you once again for being here. We will see you next time.